Hello everyone, and welcome to Module 3, Part 4. I am saying this because there were some things that I wasn't able to say to you on Part 3. I wanted to remind everyone, if you're doing your assessment on patients and you notice that they're on hypertensive medications or any type of medications and they don't have history of such, make sure that you speak with your healthcare provider and let them know about the medications that they're taking. So maybe he or she can reconsider the use of the drug or possibly stop the drug. An important reason for doing this is we also want to minimize polypharmacy, as we spoke of earlier in the previous Part 3 of Module 3 when we spoke about polypharmacy. So make sure that we talk to our practitioner, let him or she know that the patient is taking medications that either they don't have a history of and probably should not be on a medication, and it should raise some type of concern or issue with the practitioner, and then possibly the medication can be stopped. Now I'd like to talk about enteric-coated pills, which I didn't highlight. It's in your previous PowerPoint, but I wanted to make sure that I put emphasis on sometimes those pills are very hard to swallow. I'm not sure if you tried swallowing an enteric-coated pill, and remember, the older adult may have a dry mouth on top of that because possibly dehydration may be playing a part. So make sure if they're having a hard time swallowing the pill, make sure you try to reposition the older adult and give them more fluids when they're taking the pill so it can go down. Okay? Enteric pills, they for sure, and I know that you know, but I'm just going to say they should not be crushed or split. Also, I'm just reinforcing, and I know we spoke about aspirin earlier, but I want you to know that some of the older adults, they have arthritis, and a lot of them take aspirin for their arthritic pain. So sometimes when they come in complaining about dizziness and things, or having episodes of dizziness, look at their lab values. See if they're anemic. Sometimes testing their stool, they may have positive for occult blood. So when we're doing that, let's try to assess our patients even more in detail and ask about, hey, are you taking aspirin? Think about drugs that we know that can cause such a thing. Excuse me. Anemia and positive occult blood, it indicates the presence of gastrointestinal bleeding, which we all know. We also know that from previous slides that aspirin is commonly implicated in episodes of GI bleed. So make sure we ask those important questions. Now let's skip over to constipation. Now I know I just jumped a whole ladder, but I just want to touch on some highlights. Now I know constipation is common in the older adult, and we read that in our chapters. So when a patient is complaining of constipation, try not to just offer laxatives to the patient. Try something that's non-pharmacological. There's other things that we could have the patient do. So instead of saying, oh, let's take a laxative. So let's make sure that we continue to be an advocate for this patient. Let them know you can teach them about diet changing, or maybe increasing the amount of fluids they drink, things like that. All right, here I go skipping again, but remember, this is my overview. I want you to look at page 229 under the title Metabolism, Detoxification, and Excretion. I want you to know and just keep in mind always throughout your nursing career, when kidney function is reduced, the biological half-life can increase as much as 40% and increase the risk of adverse drug reactions. I apologize for my puppy in the background that's on lockdown. Okay, so I want to make sure that you guys really pay pay attention to that. Remember, when kidney function is reduced, you have an increased biological half-life of a drug. So, what happens with that? You have increased risk of adverse drug reaction. Hello everyone. I know I had talked on safe medication use, but the previous Module 3, Part 3 did not give me enough time to say everything I wanted to. So what I just said previously was some highlights that I also wanted you to know. So thank you so much for listening, and thanks for having patience with listening to me and tolerating my dog in the background. And I hope this is helpful information for you.